You can get an amazing product without using a 510K cleared device, but that's not best practices. Without very clear knowledge about how to create a high quality product. Factors that accelerate healing or accelerate recovery include pre-injection optimization, as well as after injection, we use laser therapy as part of our recovery protocol to accelerate the resolution of the healing cascade. There shouldn't be a recovery timeline. The recovery timeline may differ from intra-articular injections versus soft tissue injections. It's different. It's different tissues, different
So it's
disease
more like
process. PRP can be used for tendinopathy, which is also referred to as chronic thickening, or partial tendon tearing less than 50%. PRP can be used for higher grade tears, usually greater than that 50% cutoff. Our clinic prefers to use cell-based therapies. Regarding number of treatments, really depends on initial dosing. There are two strategies, either for lower dose products, you may need multiple dosing. For a high dose product, a single injection has been shown to be effective, and we would expect in our clinic expectation of greater than 50% improvement by our 8-week mark. So what we usually tell patients is that they'll have pretty significant pain, similar to initial injury. For the first 48 to 72 hours, this should resolve fairly quickly and be able to return back to activities of daily living, gentle exercise program in the initial rehabilitation phase by day 4. So we recommend for our patients in their first immediate post-injection period, we recommend bioactive sleeve, compression, infrared, laser therapy, topical CBD, acetaminophen, and narcotic medications as prescribed by your physician, depending on severity. Gentle home exercise program with range of motion and stretching may need limited weight bearing with a possible protective brace, but this is all to be personalized depending on the injury, depending on the patient, depending on the tissue, depending on their recovery protocols. So pain that is not relieved or pain that is not managed by oral and topical medications, rest, ice. The first conversation should always be with your physician, letting them know that you're having more pain than expected, and they can walk you through their additional escalation protocols as to the next steps. Maybe. We recommend, it depends on the centrifuge. In theory, it can be used. The issue may become that you don't have I guess what we can say is best practices are that we use devices that are indicated for the formation of PRP. And then I guess you can just say if you have the proper training and protocols, there are simple ways that people are creating PRP with a standard centrifuge, but you may need an insert for specific containers. And it sounds like I'm being vague, but there's so much of the specifics. it's I don't want to go too crazy, but I guess I think being just vague enough is okay. You can get an amazing product without using a 510K cleared device, but that's not best practices. Without very clear knowledge about how to create a high quality product. If you have all of those pieces of knowledge, then great. If you don't, or you're wondering like, what best practices are, I would rely on the high quality kits who have already worked this out and have a reproducible, simple way to produce high quality, high dose PRP. If you're relying on yourself and you're trying to do it yourself, and you don't have all of the spin rates and the ways, the proven ways, and you don't have a way to test of what you're making, then I would leave it to the professionals, honestly. To do it yourself, just like you do a home improvement project, but for reproducible results, case after case after case after case, without being able to measure it. So if you're able to measure it and you have reproducible, you can check and make sure that you're doing it right. Great. But most people don't have that ability to check the quality. So that's, I think, the other caveat is if you have the ability to check the quality of the injectate and, have a clear step-by-step do-it-yourself process, it can be done. That being said, if you don't have all of those things in place, then I would rely on the 510K cleared kits that have a reproducible, reliable way to create a standardized injectate. That is centrifuge dependent. So it depends on what kind of centrifuge you're talking about. It depends on what insert you have in the centrifuge. It depends on what size tubes you're using or conicals you're using. So that is that. Then this is part of that. Like, if you want to do it yourself, you have to be very clear what you're using, how you're using it, when you're using it. There's not just one RPM that you can be like, all right, we're all good. So if you look across the board, all the companies have different RPMs because they have different inserts and they have different size tubes. So for like the Apex 60cc kit is 3,500 RPM for 10 minutes with the Drucker brand centrifuge. But this is all searchable if you want to, I mean, you could look up and chat, like, please list the top 10 RPM, and really we should be talking about RCF, but top 10 RPM speeds for the top 10 PRP systems and the top brands of centrifuge that they use. So it's not to facilitate the separation, it's to make sure it doesn't clot. And it's either heparin or ACDA or sodium citrate. You have to be able to test each sample on a high volume hemocytometer that tests at the high end of the platelet counts. That's so the settings, they have to allow for high concentration platelets. Normal hemocytometers and normal laboratories aren't calibrated for these high concentration solutions. So there are specialized high concentration hemocytometers, such as the Beckman or what is that one I use? Horiba, 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 that are calibrated to count the high concentration. So if you do that and then you calculate how much, you measure the number of platelets in your blood sample before centrifugation, and then measure your platelets after, and then you can calculate the dose, and then you can calculate the percent recovery.